for avoidance of any doubt, and for those who are eagerly waiting and wanting to find out what's on the menu this afternoon, we're taking a look at the seriousness of something called hepatitis B in Nigeria and the need for everyone to take charge. That's the second part, whereby we will, or my part of it anyway, is to make sure that I get that enlightenment campaign to you as quickly as possible, and more importantly, hopefully that it will meet you up well too. Joining me in the program is Dr. Francis Ekwe. I hope I got that right this time around, right?
Yes,
Francis. All right, welcome. And I want to ask, just curious here, which particular field of the doctor are you specialize? Do you specialize in?
I'm a gastroenterologist and hepatologist.
That's a mouthful.
Yes.
Generally, just say, for
Yes.
example, now, what do you deal with here?
So I'm a specialist that deals with the disease of the digestive tract, which involve the intestine, the stomach, the intestines, the liver, and the pancreas.
Oh boy, how many years did you have to go to school for that? Donkey years, I'm sure, but it's all well worth it, because we are going to be tapping into that long, well-experienced mind of Dr. Francis this evening on the program to take a look at the seriousness of hepatitis B. But before we take another step, you know what? Fire Williams has a tradition, right? That every guest that sits down on the hot seat, before the question starts pouring in, that's from me anyway, you get to greet Lagosians in your mother tongue, in your local dialect, in your language. And what would that be? I mean, Dr. Francis Ekwe is from where?
I'm from Benue State, in Idoma speaking part precisely.
So we're going to be hearing how you say hello and welcome in Idoma, right?
Okay, along my no,
Aya.
yes,
I think that's the reply, right? I think that Aya goes for a whole lot of things. You're all right, Aya. Are you feeling okay, Aya? I mean, it just works out well for everybody. Wonderful people, very warm and accommodating they are. But we have one of the ambassadors here this evening on the program, taking a look at the seriousness of hepatitis B in Nigeria. All right, doctor, I think the first question would be, what is hepatitis B, right?
Thank you, Femi, for this question. Hepatitis simply means a disease or inflammation of the liver. The liver, we know, is that organ in the body, in the abdomen, that does so many functions. In Yoruba, it's called Edo. Now, this liver does so many things. So when there's any disease or inflammation, which I will explain, affects the liver, it is called hepatitis. And inflammation is simply the way the body will respond to any injury. For instance, somebody falls on the ground and hits his knee, and you say, oh my God, what's that? The place is swollen, painful. You say that's an inflammation going on because of that injury. So if that happens in the liver, it is just called hepatitis. Now, so anything can cause hepatitis in the liver. But today we are focused on hepatitis B virus. Hepatitis B virus is an infection. Infection is anything that can be transmitted, any illness that can be transmitted from one person to another.
So this inflammation now can be in different ways. It can be the one that you mentioned now, whereby it's an infection.
Causing that inflammation. Alcohol too can cause that. Herbal medications can cause that. Drug overdose can cause that. So anybody who has hepatitis, you ask, what kind of hepatitis do you have? Then they can come down and say, okay, well, the doctor says he or she has hepatitis B virus, or he or she has alcoholic hepatitis, or toxic hepatitis is coming from herbal medication. So in this case, this discussion, I guess, is going to be on hepatitis B virus infection causing hepatitis.
So how do you differentiate? How do you recognize, or how do they show that this one is the one that is caused by an infection as against the one that is caused by alcohol or the one by herbal? What are the symptoms that it exhibits that start pointing you to that direction? Okay,
good. Usually to make a diagnosis like this, a few things can be done. One is a history. You ask the patient the question, have you taken alcohol? Have you been taking
alcohol?
Yes. So in such cases, you can tell that these symptoms you are saying, I'm getting to that. You can then know that it may be coming from alcohol, it may be coming from an infection, it may be coming from something else. And then the second thing you will do, which the complaints, this person will tell you that they will probably have yellowness of the eyes, fever, abdominal pain, vomiting and all that. But the thing specifically that can differentiate which type is causing that will depend on the test. Your blood test will tell you the cause of these symptoms this person is complaining of, is hepatitis B infection. Because of these complaints, it's from alcohol. Because of this, so the test would then differentiate these different types of causes of hepatitis. So the history or what the person tells you is also very important. And then in addition to what the test will tell you, so you can say, okay, this person has, the hepatitis this person has is from this infection. Or from alcohol and from all that I've said earlier.
All right, so you can easily find out how that person got infected with it. I mean, this infection, as the case may be, is it gender sensitive in the sense that even with all the things that you mentioned and how we can contract it, right, it seems to be leaning toward the men more. Why I'm saying that, okay, well, you probably have men drinking more, right? You probably have men and women drinking, what they call it, herbal medicine. Anybody can do drug abuse as the case may be. So who is more predisposed to this? Okay,
because the hepatitis, this around, a lot of things can cause hepatitis. So the different causes may lean towards a particular gender. For instance, if in an area where people take a lot of alcohol, you could rightly say the men take more alcohol. So maybe alcoholic hepatitis may be towards the men. But for hepatitis B, which is the crux of this discussion, we'll then tell you that there is no really gender specificity. It affects men and women equally. Children, the same thing. So, but I'll say something, because of the seriousness of this hepatitis, particularly hepatitis B, the World Health Organization has set a day for, to create that awareness, which was July the 28th of every year. A few days ago, yes.
So it was World Hepatitis Day a few days ago, July 28th of every year.
Every year is World Hepatitis Day. In this case, they try to create awareness that millions and millions of people, hundreds of millions of people are suffering from hepatitis, and it's good people are aware, particularly of their status in the case of hepatitis B infection, and then be treated. Because for most of those times, the hepatitis B infection is the commonest cause of liver cancer, liver failure, and these are hugely preventable. So the awareness to let people know your status, know what your status is, so that in that case you can get vaccinated. And if you are vaccinated, then it reduces your chance a lot of having this infection and then dying from the complication of this illness.
I kind of like the fact that as much as you're talking about the seriousness of this, it seems that there is hope somewhere in terms of treatment and, if possible, a cure. Is it curable?
Okay, for hepatitis B, for now there's no cure for hepatitis B, but it could be treated. It can be treated. For hepatitis C, there's not a cure. Another kind of hepatitis, the other types of causes of hepatitis I have mentioned earlier, those ones can be treated based on what is causing that. Someone who is taking alcohol, for instance, you just stop taking alcohol.
And it eases off.
Yes, it eases off. Depending on the stage in which the person comes to the doctor. If the person comes
to the liver. So the thing there is early detection again.
Very important for most illnesses we treat in this part of the world and everywhere, all over the world. So we encourage people to seek care early. Know your status. In fact, the theme of this year's World Hepatitis Day is eliminate hepatitis and finding the missing millions.
What do they mean? I mean, what are they trying to find out with that kind of theme?
Okay, one, eliminate hepatitis, meaning that those that are preventable, those that people can actually take care of, you can then eliminate where those things are coming from. And then finally, missing millions, that there are millions of people who do not know their status.
Unreported?
Unreported, yes, they don't know their status. So we say, go have yourself tested, and if you are negative, get vaccinated. If you are positive, see the doctor.
So it's that simple, Dr. Francis?
It is.
If you know your status now, there is a vaccine. Is that what you're saying?
If you are negative,
if you are negative, yes. Just like we have some very, very important vaccines that have saved our life when we were young, there are vaccines that you can use as an adult that will make you not contact hepatitis B, right?
Yes,
even with all the factors you mentioned earlier, that okay, you have this kind of lifestyle, you've been doing this, you take that vaccine, it removes you off that list.
Yes, that vaccine again is specifically for hepatitis B infection. For the alcohol, you just need to stop drinking. That will stop you from having alcoholic hepatitis. For those who take herbal medications, we advise them to stop taking herbal medications. So for hepatitis B, amongst all these I've mentioned, hepatitis seems to be the one that causes the most problem and yet preventable. That's the one we try to talk to people about, because it is preventable by the use of vaccination. So we ask people, so why don't you know your status, get vaccinated, rather than coming 20, 30 years later with complications at that time that becomes difficult for your doctor to treat. That's why we're saying finding the missing millions. A lot of Nigerians. If you hear the statistics about the scourge of the disease all over the country, you'll be amazed. From the last statistics we have, about 25 million Nigerians are positive for hepatitis B. And
25 million Nigerians.
And a lot of these people do not know their status. If they are
Right.
positive or negative.
If you're listening in right now and what you're listening to sounds a little bit, how will I put it now, scary, frightening, and more importantly, quite useful to you, well, we've been talking for the last 15 minutes about the seriousness of hepatitis B in Nigeria and the need for everyone to take charge. Everyone in this case, names me, Dr. Francis, you, and of course you listening in right there, who think that this one way or the other is something that you need to start paying attention to, apart from every other thing that we're paying attention to, you know, going from point A to point B, trying to make ends meet, trying to make money, trying to, you know, live a responsible life. But sometimes on one very, very odd day, something just creeps up. You feel funny, you go to the doctor, and you're diagnosed of having A, B, or C. I'm not talking hepatitis here, so please, no pun intended. I've been talking with Dr. Francis Ekwe. Yeah, he's one guy out of other many doctors out there who are taking this very serious and bringing this campaign to you at this time on Safety Train on Lagos Traffic Radio 96.1 FM. Now let's talk about, can these hepatitis B, let's talk about, first of all, let's talk about the most vulnerable ones amongst us. I'm talking about women, I'm talking about children. How does this manifest, or how does this show in their own life? How does this affect them?
So for the children, what the government has done, it has prepared immunization for children. So I bet they receive immunizations. They have that through the stages of development, and I would say at this stage most children really don't have hepatitis B as at what was there 40, 50 years ago. Okay, so the symptoms for children, largely for viral hepatitis, I'm talking about hepatitis B now, the children usually do not have those symptoms. They usually do not have symptoms that much. Maybe fever or here and there, but usually not that serious. For
Unless
adults,
they are tested.
Yes, tested before they can know if they have or not. For the adults, they make a good number of the adults we have do not have symptoms. Okay, which is something that is really of a concern, because a good number of times the time people with hepatitis B get infected in this part of the world is during childhood. 70% of the time, the adults you see who have hepatitis B have gotten it at childhood. The remaining 30% will have gotten it at their adulthood. So those who have acquired this infection during childhood usually will not have complaints.
So let me get this straight now, Dr.
Yes,
Francis. You can have this as a child and it's in you up till you get to an adult unless you test for it.
Yes, the majority of people do not have symptoms. They just come sometimes with the complications, having liver cancer.
At that end, it will have been towards the, towards the end stage at that point.
That's very correct. While some people may come with some symptoms, but we ask people to test because symptoms are not a very good way to be able to diagnose somebody has hepatitis B. That's what we keep saying about, go get yourself tested. There's no way you can look at yourself in the mirror and then you can say, oh, this looks like this.
It hides very well then.
Oh, it does. And that's what's the danger about the hepatitis B. However, some people may come with complaints of having yellowness of the eyes, what we call jaundice, abdominal pain, swelling, not sleeping properly, vomiting, stooling. And sometimes symptoms look like that of malaria, and you think it's malaria, except that the eyes become yellowed, and the doctor will say, oh,
this is
this
something
will
else
look like,
again.
this will look like hepatitis.
At that stage, is it still too late?
At that stage, then it depends on how bad the infection would have been. It's difficult to say. Most people, adults who have those infections, usually recover. The eyes become clearer, they become better. And those that do not recover, it becomes worse off. They become unconscious, and they may die from those. But yes, the thrust of this discussion again is not to scare people. It's to tell you that you can have this tested in the first place, and then you can get prevented for those who are negative. Then coming to pregnant women that you have asked me earlier. So for pregnant women, the symptoms are like that of the adults that they have. Most times they may not find out they have. Maybe during the antenatal period when they are testing for that test, they may test for the hepatitis B and find out they are positive.
At that period, would there be a way whereby the mother can transmit this, just like HIV, right? AIDS and the rest, I want to believe that it's transmittable from mother to child. Is this the same? Does this follow the same rule?
A little bit different. The infection is usually highest during delivery. When the baby is coming out from the mother, fluids, body fluid, bloods may be exchanged, that the baby may become usually infected. Or shortly after birth, when they put the baby to the breast and the mother begin to breastfeed a child that is unimmunized, and then the child become positive. Those are the areas that have the highest concentration.
And again, if it is properly tested or quickly tested and detected, that can be treated at that case.
So what happens in this case, if the mother is tested early during the antenatal period and she knows she has hepatitis B, a gastroenterologist will follow, or a qualified doctor will follow her up in the treatment of this hepatitis B, and then depending on one or two criteria, the tests she does will show, will determine if she needs to take medications or not. Okay, for the baby, what happens to the baby? The baby gets a special injection, what they call immunoglobulins, and I'll try and explain that later.
Yeah, because that's not a big English for me.
Yes. So the immunoglobulin is given to the baby at birth. This prevents, reduces the risk of the child getting the hepatitis B from the mother. And then the child takes the usual vaccine every other child is meant to take at birth. With that, the child is immunized, and now the mother can breastfeed the child and the child safely, and the child will not have this. But if this is not noted, she doesn't do antenatal, or the hepatitis B is not checked, and she doesn't know, and she gives birth without being full of, she can easily transmit this to her unborn baby. But the immunoglobulin greatly reduces the chance of the baby picking up hepatitis B at birth.
Wow. So much to, wade through, so much to learn, and so little time. All right, if you're listening in right now and this one way or the other is resonating, and you want to ask a question from the good doctor, that's Dr. Francis, you can put a call through to us on the program. Do not forget, please turn down the volume of your radio set if you're going to call in, and make your questions as brief as possible, so that we can get some people who's out there, and still some gray areas left in understanding this, can put a call through and to the good doctor, and we can see how we can add it together to make clearer sense. So you can join us on 080-99-120-777 at 080-99-120-777. I also have joining us in the studio, is it Dr. Bello or Mr. Bello? Mr. Bello at Achilike, right? I hope I got that. And welcome. And Mr. Bello is with Biofem. Now, these are the ones. Biofems are one of those agencies that are really quite particular, taking a look at the seriousness of this hepatitis B, and of course bringing Dr. Francis in conjunction with Fire Williams on the program. Hello and good afternoon. How are you, sir? I'm all right. What's your name? Joseph. All right. So what's on your mind concerning hepatitis B? Could you say that last part again? You're still skeptical, right? That it never leaves you, and we've been talking that there's no cure, and you want to find out from the good doctor if you need to be scared or you need to take it more serious. Am I correct? Right. All right. All right then. Let's listen to what the doctor has to say then.
Okay, thank you, Joseph, for this question. Hepatitis B at the moment, we know it's not curable but treatable. Okay, and then majority people who have hepatitis B, a few outcomes are expected. Majority of the people will probably have hepatitis B for the rest of their lives, while a certain percentage would probably eventually or eventually become negative. Now, becoming negative is predicated on a few criteria. Those who have if you have hepatitis B infection for the first time, what they call the acute infection, you have a large tendency of becoming negative. I think that may have been the case in what you just said. Then secondly, some people may have had it, and then one way or the other, the body is able to clear the hepatitis B infection. Not because they had it recently, but somehow over time, the body is able to clear that away. And then thirdly, with some of the medications available, some people may be able to clear the hepatitis B and become negative. But what we advise people is that if you are hepatitis B positive and it's negative now, it will be advisable that you see your doctor to have that confirmation that you are truly negative and you do not have, and not because of some errors here and there. But again, congratulations, Mr. Joseph, on your status.
I mean, there's no good news on that than receiving a clean bill of health. Hello, good evening. Hello, can you hear me? What's your name, sir? Dave. All right, go ahead, Dave. Quickly, though. Oh, good. All right, then. That's a very good question, then, Dave. All right, keep listening. I think we need to take that one as quickly as possible. I mean, how does one get contracted by? Okay,
thank you, Dave from Ikeja. Hepatitis B can be acquired with these few. I'll just try to mention them. From childhood, usually we say mother to child can be gotten, or from practices in which people do. When people share sharp objects, share toothbrushes, from somebody who is infected, or share sharp objects like maybe clippers, razor blade, nail cutters that can, cause exchange of body fluids. Can also one can acquire that, and also through sexual intercourse, one can get infected from hepatitis. Can get infected with hepatitis B. We know it's about 100 times more infectious than HIV.
Really?
So we know that it's easy to get hepatitis B for those who are not immunized. So those are some of the symptoms, some of the ways people can get, infected with hepatitis B. But as I said earlier, from the statistics we have in this part of the world, 70% of the people who have hepatitis B got it from, during that childhood period. The remaining 30% would have gotten it from these few things I have mentioned.
And you can only, as at least go through it or actually get relief when you easily go for a test, right?
Yeah, so the test will be able to identify if you are positive or negative. That's what the test will tell. Because if you are relying on symptoms, we say symptoms are not a good way to tell if you are positive or negative. So testing is for everybody. So for Nigeria, where we have a high epidemic, a high endemicity rate, where we think there's a large number of people who are hepatitis B positive, we know that the rate of people acquiring this illness is high. So we recommend that people test themselves, and if they are positive, they get treated. If they are negative, they get immunized.
All right. We're wrapping up on the program at this time, Dr. Francis, because of time, but I really quite appreciate your input on this concerning the World Hepatitis Day, Hepatitis B Day, right?
Which was the World Hepatitis Day.
Which
so
is
B is part of
the condition itself, which is celebrated every July 28th of every year, and that's one thing you need to put on the calendar. Maybe you should just actually even put that as the day that you want to go for your hepatitis B test or screening, as the case may be. I mean, once is right. Is once you find out, you get vaccinated, you don't need to be doing the test anymore.
I'll quickly add to that. For those who get tested and are negative, they take immunization. They have 3 doses they will take within a period, depending on their schedule. They will take immunizations, and then they are protected. Then we advise them to take booster doses time to time.
All right, then, which is very encouraging, at least for now. We've been listening to Dr. Francis Ekwe. Yeah, Ekwe, begging your pardon. He's a gastroenterologist, and we've been talking about hepatitis B. But I also mentioned earlier that he's not here alone. Bello Achilike is the product manager for Biofem Group Limited, and he wants to share with you how they can get in touch, or more importantly, you have further questions concerning how you can either go for testing or for treatment, as the case may be. He's going to be giving out a couple of contact details. So Bello, if you don't mind, you can do the honors.
Okay, so Biofem can link those who are positive to care. You can call 080 7819 0845, 080 7819 0845. You can also follow Biofem on Facebook, Biofem Group Limited, on Instagram, Biofem Group, on Twitter, Biofem Group, and our website is www.biofemgroup.com.
All right, well, we'll be giving out all these contact details in response to some of the messages I'm getting here on WhatsApp, like this person that says he's been confirmed hepatitis B positive for over 20 years, and the doctor told him that it may disappear, but it's still positive for now. So why not get in touch with Bello and see how you can take that a step further, knowing more about something that actually helps in trying to see how you can either bring relief or, at the case may be, remove it or eradicate it on its own again. Dr. Francis, thank you very much for your time, and we do hope we have a chance once again to talk about hepatitis B and its seriousness. But if you can, for just a few seconds, how serious can hepatitis B be in terms, and what should we do actually as people right now?
Okay, I'll take the second question. For those who are positive, we recommend that they go see their doctor, and then they'll be followed up, closely. And that's a very important aspect, since this is a chronic illness. At the moment there's no cure, you can't just leave it and say you're not going to,
It's not a death sentence, as the case.
Yeah, so to say, yeah, it's not a death sentence, but we expect that you do your checkup regularly. And then if you, for something you do not take care of, you expect that it may give you problems. So for all those who are positive with it, my message out there is that this is not a death sentence. Don't look at it as the end of the world. All you need to do your checkups regularly, see your doctor, and then you will live a very quality and
Dr. Francis, once again, thank you very much. Bello, thank you also for your time and your input on the program. On Safety Train, the train will pull into the station once again next week by His grace at 4:30 on Lagos Traffic Radio. Have a great drive home, especially if you're getting just to your destination. But if you're just starting off your journey, well, stick around for more traffic reports. Yeah.